Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I'm joined by Val Carrillo, Community Outreach Worker, and Amanda Cook, the Mobile Health Outreach Bus, or MHOB, Program Lead at Oxford County Community Health Centre. Through the Systems Navigation Access and Partnership, or SNAP project, CHCs are increasing efforts to improve health and social systems navigation access to strengthen Canada's healthcare landscape and eliminate health disparities while improving population health outcomes. And we are going to learn about the Oxford County CHC's SNAP project today. How are you both doing?
Yeah.
Oh, for a second I couldn't hear you, but then it all of a sudden came back. So you're both good.
Yeah.
Yes, perfect. So Amanda, I'll start with you. If you could tell us a little bit about Oxford County Community Health Centre, the community that you're serving, and the programs that you offer.
Sure. So we mainly serve marginalized, low income, those that face significant barriers in their life. Some of the programs we have here, so of course we have primary care with doctors, nurse practitioners, NPs, RNs, RPNs. We have physiotherapy. We have dietitian. We have chronic disease. We have housing stability teams, both youth and adults. In those programs, we actually have 2 transitional houses. One has 14 beds, one has 7. We're literally this month about to open a youth housing stability transitional house for 4 beds in that one. We have outreach, both for community and primary care. We have sexual assault services. People used to have to go 45 minutes if they'd been sexually assaulted for any treatment. So we opened that up fairly recently here in Oxford County. We have a RAM program, so a rapid access to addiction medicine. We have a community dental program here. So for 18 to 65, free dental. We work with the School of Dentistry out of London, and their students come and do it. We have, of course, our mobile health outreach bus. We have mental health services, therapists on site. Our 2 most recent programs that we just started, one is called the First 5. So that's for little ones age 0 to 5 to get connected to wraparound healthcare services if they're not connected to a primary care provider already. So they can monitor their injection, like their immunizations and their growth and all of that. And another one that we just started this week is we just brought primary care to Tillsonburg. It's always been a doctor-focused community. We brought a nurse practitioner in there and an RN. So they just started this week. So they'll be rostering new patients very soon.
Wow, you truly do it all over there. I mean, I know we talked about wraparound care, but you're doing everything. That's absolutely wonderful. So as you previously mentioned, you've received funding through our SNAP project, which I believe is well underway. And it's for the mobile health outreach bus, I believe. So I'm excited to hear more about what you've been able to achieve so far and the impact that the project is having and what the project actually is.
Yeah, so the mobile health outreach bus is an outreach worker from the community health center that goes out into community and meets people where they're at. So that can be in downtown, that can be in their encampments, and it serves throughout Oxford County. So Amanda goes out on the mobile health outreach bus in Woodstock pretty much every day of the week. It got expanded to 5 days a week in Woodstock, 2 days a week in Tillsonburg with another outreach worker, and every other week in Ingersoll. With the mobile health outreach bus, we have nurses going out twice a week, partnership with CMHA that also goes out to support with mental health. The fire department here in Woodstock also goes out with us every other week. Regional HIV/AIDS Connection in London is starting to come out again. Am I missing any partnerships?
Oxford County Human Services.
Oxford County Human Services also comes out with us to support the population.
Yeah.
So the whole idea is that people are able to ask any questions that they have while we're out and make those connections and really meet people where they need us to meet them. So we're not making it difficult for them to come to any appointments or coming into the office if they don't have transportation. It is really accessible access to them to get everything that they need. So the whole idea of the SNAP project was to increase presence in community. So being able to go out more times during the week, both Woodstock, Tilsonburg, Ingersoll. This also allowed to increase outreach encounters. So we now have a lot more outreach encounters based on everyone that is being seen during the Hub. So this increased referrals with housing, income tax, reminder for upcoming appointments, government applications such as Ontario Works and ODSP, and accompanying people to appointments to do a lot of advocacy, which sometimes that can be very time consuming. But now we're able to do that with it being able to have one more person within the SNAP project. This also created other uses of like secure ID program. So we're really doing ID for people since this is something that most people require. So the secure ID program is a program where we are able to keep people's original ID in a secure location with their consent. And if they ever need it, they can always come and ask for it and we can give it to them and they will bring it back, or they can keep it at that point, or they can get copies of it whenever they ask for it. We have also been able to provide community food calendars. So this is something where usually myself will put all the resources together of food calendars for Oxford County. So there's mostly Ingersoll, Tilsonburg, and Woodstock. And every month those gets distributed throughout the community. So everyone knows where they can access food throughout each month. We have also been able to participate in more community events. So really being able to have a presence, the CHC have a presence with other community agency events. So we were just at the Pride raising flags throughout Oxford County.
Family Pride Days.
Family Pride Day is coming up as well. So we're gonna be a part of that. So it's really just having one extra person has allowed to create to support more people and really support more community agencies. We have also been able to use like the tablets out on the street. So like doing really encounters right away and looking up the resources that are needed for the person right at that moment.
The nursing, when they're out, they're
Yeah.
able to use the tablets as well. With our nursing out, we're able to divert some emergency room visits for clients that wouldn't normally go to emergency room anyways, because treatment looks different when they go there versus when we're accessing them in community. So they're able to look up different medicines and stuff like that and just feel like they're giving the proper information while they're out too.
Yeah, so overall, like the SNAP project allowed to have one more person, and this has allowed for an influx of referrals and an influx of advocacy, of support, of having more follow-up with people throughout the community.
That's incredible. I have two side questions that I'm just curious about. You had one acronym in there, I think it was CMAH, and I was just curious what partner that was.
CMHA, the Canadian Mental Health Association.
Amazing. And then I was curious because I think you mentioned the fire team as well. And is that more just people who are curious and have questions, or how does that community partnership work? I just find that really interesting.
Yeah, so it's a fire educator from Oxford County. She comes out every other week to educate people on fire safety. So mostly at encampments and anything like that, she will educate them on having fires away from dry branches, that way it doesn't pick up, or just that having that peace and someone they can communicate with openly, and have trust in that person.
Wow, that's so smart. And so that's why I was like, why? But no, that makes a ton of sense. It's a wonderful use of the SNAP project. Have you experienced any challenges while trying to implement these navigation tools through the Hub? And if so, how were they addressed?
So I find being out on the bus, one of the biggest challenges is our goal is to meet clients where they're at, but understanding that systems want them to move forward and trying to have them understand without pushing them that we need to do certain things because not us as our program, but the systems want them to do their ID and it might not be a day they want to do it, or, we need to get your income tax done. Well, they don't really want to do it. And the follow-up after that, having the follow-up and the continual contact sometimes and getting them to engage on not what we as our program believes they need to do, but what the system as a whole believes they need to do to move forward from where they're at. So that's probably my biggest challenge is getting the follow through.
That makes sense. I'm sorry, Val, did you have anything to add to that?
Yeah, so a big challenge for myself is that I am the community outreach worker. So I am covering anyone that is not a client, a patient of our center here. It's every community within Oxford County. So I'm in Woodstock, Tillsonburg, and Ingersoll various days throughout the week. So it's just knowing all the resources for every place that I'm at, making sure that they're connected to the right resources, and just being able to generally connect with each community, have close connections and create rapport with those communities has been a bit of a challenge.
That makes sense. And of course, on the flip side, what successes have you been able to encounter through this project?
I think one of the biggest successes is definitely our secure ID program, starting that. Clients are really happy that we've done that because they're always losing their ID before that. We would get it for them, they would lose it, then they can't access their bank or they can't do their income tax. Or now, in order to get on our housing lists, you have to have an ID and your taxes done. So those are things that we're stopping people from being able to move forward. So being able to do that, I think, is one huge success. And I really feel the relationships that we've built in community, both with clients and with community partners, I think is huge. I think people underestimate what a good relationship really looks like and how valuable it is to have one.
Yeah,
Absolutely.
I think another huge success has been able to really participate more in community events in general.
Mm.
So participating in different meetings, participating in different events, creating those relationships with partners, with partner agencies and organization has really been successful in supporting clients overall, because then we have a way of communicating with them and letting them know what's going on with a client. And sometimes there's circles of care where it's different agencies are working together to support one client to make sure that there's no gaps in this client's success.
Yeah, that makes a lot of sense, and that's absolutely wonderful to hear. And it sounds to me, but I don't want to presume that you're going to potentially be able to sustain the SNAP project work after the project ends.
Well, we're hopeful, that's for
Oh,
sure. We do know that it's done good work and we see the results that we've been able to create. And just the work that we've been able to do while having it has been amazing. So we're hopeful to be able to continue it through continued grants, and we'll be doing applications as often as we can for every grant we can find until we are able to um, find permanent, sustainable funding, which hopefully one day comes.
which perfect segue to my next question, which we just discussed in advance, but I ask this in every episode. What would increased federal or provincial investment allow for not only Oxford County Community Health Center to achieve, but also how would it impact the SNAP project?
Yeah, it would allow us to continue to do the work that we've been doing out there and also continue to address the different needs of the community as they change because they're ever changing. So if our program doesn't change with them, then our program becomes stale as well. So we have to be able to have the funding to be able to change with the community's needs. So more funding from them would help us continue doing and grow.
Absolutely. Like I said at the beginning, more money. All we ask
Always more
is
money.
continued investment. Um, well, this was a very lovely episode. Val and Amanda, thank you both so much for telling us about the SNAP project and the amazing work that's going on in Oxford County. I feel like it's not so far that I shouldn't someday be able to trek over there and see what you're doing in person, which would be absolutely lovely. And if anyone listening to this episode would like to learn more about the MHOB program or any of the amazing work that you're also doing, because you are doing everything that you possibly can over in Oxford County. If anyone would like to learn more online, where would they go?
Yeah, so they can find us on our website, which is oxchc.ca. We also have a Facebook page, which is Oxford County Community Health Center. So if you want the most updated information, usually all of our programs, events, and everything are posted on our Facebook page. You can also call the center at 519-539-1111, or you can email info@oxchc.ca. So there is really no wrong door to connect with us. Any way that is easiest to connect
Yeah.
for anyone, you can always we can figure out how to connect with you.
That was the most efficient answer. No one, I think, in the 3 years I've been doing this has given a phone number, but also like the most non-barriered answer, which is what
Yeah,
we what we want.
Yeah.
Well, we
That was
also want
wonderful.
people to
Yeah.
have access to an email, because if they don't communicate well in English, a translation is easier throughout an email than what it would be through the phone. Or if they don't have access to internet, then there's the phone option.
Yeah.
Digital
There-
inequities.
Yeah, our theory is no wrong door here, right? So no matter who you call or how you call us or get a hold of us, you're gonna find one of us.
You'll
somehow.
find somebody, yes.
Yeah.
That's
Yeah.
amazing.
Absolutely.
Awesome. Val and Amanda, thank you both so much for being here and chatting with us today.
Thank you so much for
Yeah.
having us.
Yeah, it was great. Thanks.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.